Hi, today we're going to cover that includes we're going to cover the cardiovascular anatomy, excuse me, that includes heart anatomy, the coronary circulation around the heart, fetal circulation, and a little bit of cardiovascular anatomy. So the circulatory system functions is to obviously deliver blood to tissues and organs, right? So deliver oxygen and nutrients to the organs and tissues and remove carbon dioxide and wastes. The cardiovascular system, when you think of cardiovascular, I want you to think of heart and blood vessels, right? So cardiovascular, heart, blood vessels. It's a closed circuit, meaning that you have arteries that ultimately end in capillaries. Those capillaries lead to veins, and then that goes back to the heart. The heart's function is to pump blood to the lungs and the body. And then the kidneys are going to filter the blood. The pulmonary circuit, takes blood to the lungs to get oxygen and then brings it back to the heart to get pumped out to the body. The systemic circuit or circulation takes oxygenated blood to the body and deoxygenated blood back to the heart. The heart is the size of your clenched fist. It's in the mediastinum, so right in the middle of your chest, 2/3 to the left of the midline. So if you make a clenched fist and tilt it a little bit to the left, the bottom, like your pinky finger a little bit to the left, then that is the location of the heart. It's medial to lungs, superior to the diaphragm, anterior to esophagus, and descending aorta. So think about that for a second. It's actually anterior to esophagus. So you want to make sure that you're paying attention to the relationship of the esophagus, the trachea, and the heart and the blood vessels. Here's a picture of the heart. So the base is the top, which is right here between, you're going to listen for heart sounds between ribs 2 and 3 for the pulmonary valves, which and the aortic semilunar valves, which we haven't gotten to yet. But then between the 4th and 5th intercostal region, you're going to listen for the atrioventricular valves. Okay, so that gives you a little bit of an idea of why you're picking those places to listen for the heart sounds or the valve sounds. Take a look at the heart. So the heart, here's the base, right? Here's the apex. The apex is a point. Take a look at the location of it in the body. So it's nestled in between your two lungs. It is anchored to the diaphragm. It has connective tissue. It has a connective tissue sac, right? So it is a double membrane sac. We'll get to that in a second. And you have blood vessels coming off of it, blood vessels going to it. And then blood vessels, here's your aorta, and the aorta wraps behind it and goes down. Here's a view looking down at the heart. Here is your sternum and your ribs. And then you have your heart, right? Your esophagus. And trachea would have been in front of that, but it leads to bronchi and lungs. And then your descending aorta right there, aortic arch, and then your vertebrae in your back. Here's your right lung, and here's your left lung. Notice the sacs around the heart. So the sac that is connected to the heart, the connective tissue sac that is the epicardium, or the outside layer of the heart, that is called the visceral pericardium. And then the sac that's connected to, or the connective tissue lining that's connected to the body cavity, is actually the parietal pericardium. So the sac is called the pericardium because that's the sac of the heart, just like the sac of the lungs is called the pleural pleural cavity, right? So there's some of the language. Parietal pericardium is the inner layer of the pericardial sac. It's the outermost layer. It's connected to the Rest of the body, the visceral pericardium is the one that's connected to the heart. So that makes up the inner layer of the pericardium. And that is the epicardium of the heart. Okay. Pericardial sac is fibrous tissue. It surrounds and stabilizes the heart. So it actually, the pericardial sac, in between the two layers is the pericardial cavity, which is containing pericardial fluid or serous fluid. Keep in mind that the sac allows that heart to expand, so relax, expand, and then contract and shrink without causing friction, right? Another thing for that sac, it holds the heart intact, and it also serves as a line of defense against bacteria and viruses getting through those sacs to damage the heart. So here's a picture of it. Here's a visceral pericardium, lines the heart. It's actually the epicardium. And then this is the parietal pericardium. Note that the parietal pericardium is made of mesothelium, which is simple squamous endothelium, and areolar connective tissue, right? You would have to cut through these two to get to the heart. Notice there's a fibrous attachment to the diaphragm as well. When you, some people, when they have dental work, they have to take antibiotics because of a heart murmur, and they want to make sure that the bacteria don't travel from the gums into the sac of the heart. You can get inflammation or infection of that sac of the heart, and that can swell and constrict the heart. So you want to be careful. Superficial anatomy of the heart on the outside, the atria, they're thin-walled. They're the ones on the top. They have expandable outer appendages called auricles. Sulci, a sulcus is a groove, right? That's should be common knowledge. The coronary sulcus divides the atria and ventricles. Anterior interventricular sulcus and posterior interventricular sulcus separates the left and right ventricles, and it carries the blood vessels that are going to nourish the cardiac muscles. So when you think of the sulci around the heart, that's going to carry the coronary blood vessels, and those blood vessels are going to supply the heart cells with blood, right? Because the heart cells aren't going to pull blood from the atria and ventricles. They're going to pull it from the coronary blood vessels. You can see the coronary sulcus. If we were dissecting in lab, you would need to figure out which one is the anterior portion and the posterior portion. You can tell anterior because the coronary sulcus, sort of the right side that separates the right atrium and right ventricle, is sort of at an angle, and then the anterior interventricular sulcus is sort of right down the middle. Here's actually what it looks like in a human heart. So this is a pickled or preserved human heart. Here's the right coronary sulcus, right? And then here's the interventricular sulcus. Note the blood vessels that are going through. Here is the auricle of the right atrium. Right behind that is the right atrium, so we can assume the right atrium is in this region. The right ventricle is right here, left ventricle is right here, and then you can't see the left atrium because of the way the heart's turned. But look at that fibrous pericardium, so that pericardial sac is huge. It's really fibrous, and then the aorta is really massive. If we could dissect, I would tell you guys to stick your finger in the aorta, and you would feel how non-stretchy or non-compliant it is. It's very strong, and it's meant to grab the pressure from the left ventricle as it ejects blood out to the body. There's also a coronary sulcus. It wraps around. So coronary, think of crown sitting on a head, right? The coronary sinus, and I'm getting a little bit into the coronary, sorry, is where the blood drains back into the right atrium. Heart wall, 3 layers. So when you think of the heart, there's 3 layers. Epicardium is the outermost layer. This is a visceral pericardium, so this is synonymous with visceral pericardium. It's made of connective tissue. It covers the heart. It protects the heart, right? Myocardium is a middle layer. Myocardium is actually all contractile tissue, so it's all cardiac muscle cells. It's concentric layers and they're organized in a pattern for cardiac muscle cells. You have atrial myocardium wraps around great blood vessels, and then you have two divisions of ventricle myocardium, and I'll show you a picture in a minute. The endocardium is the innermost layer of the heart. That is the one that comes in contact with blood moving through the atrium ventricle, and that is made up of simple squamous epithelium. Change it to endothelium because it is inside and it lines the inside of the body. So take a look at the heart. If you took a cut of this or cross section of this, magnified it, this is what it would look like. So here is your parietal pericardium, right? That is connected to your body cavity. That's dense, fibrous, areolar, and mesothelium. Then the epicardium is mesothelium, mesothelium areolar, and then myocardium, which are cardiac cells, and then your areolar and endothelium for endocardium. The purpose of the endothelial lining on the inside of the heart is to make sure that this is smooth so that blood cells don't stick to it, right? The myocardium, notice it's the biggest chunk, that is cardiac muscle. You have to have cardiac muscle to get that heart to contract. Here's a concentric ring. So take a look at the pattern of the cardiac muscle or the myocardial layer. Notice how that cardiac muscle wraps around the atria, right, in a figure 8. And so imagine these contracting. They're going to contract from the top down, and they're going to contract around those blood vessels as well to help blood flow in an organized pattern. The ventricle musculature kind of wraps around, if you think of a woman's like curl, if she had a ringlet or whatever, it's like that, and it contracts from the bottom up. So the musculature is in an organized pattern that greatly benefits or helps blood flow through the heart. They have intercalated discs. So if you look at the cardiac muscle tissue, they have intercalated discs. They connect cardiac muscle cells together. They're secured by desmosomes. These are kind of like spot rivets, like with denim jeans, like holding the pockets on those little rivets. They're connected by gap junctions so that ions can flow from one cell to another. So the intercalated discs and the desmosomes hold the cardiac cells to one another, and then the gap junctions allow for ions to diffuse from one cell to another really fast. Okay, here's a picture of them. So here is the intercalated disc, and it's sectioned, right? And here are here's your cardiac muscle cell. Notice cardiac muscle cells have many mitochondria. They're really aerobic. You don't want them to run out of ATP, right? Because these muscle cells need ATP to contract. Here's your nucleus. There's usually 1 to 2 nuclei, right? And then see along here, they actually have gap junctions in these little areas of the intercalated discs. So here's your picture. So they're small. There's a single central nucleus, branching interconnections between cells and intercalated discs. Here's a picture of a heart cell. So here's one heart cell. You can't see the nucleus in this picture, but here is the intercalated discs. They are striated, so they have actin and myosin organized in a parallel fashion for contraction, right? They would have a nucleus. They would have many mitochondria, and then they would have gap junctions as well. Notice that this one, so these cardiac cells are actually branching. So you can tell from this one and then this one above here. Internal anatomy of the heart. They have 4 chambers, right? Your right atrium, right ventricle, left atrium, and left ventricle. Right atrium, what's the job? It's the entryway to the heart. Right atrium is sort of an entryway, or the first chamber, if you will. Blood is going to collect from the body, from your systemic circuit, and drain into the right atrium, or get pushed into the right atrium. Then it goes into the right ventricle from there. Then it gets pumped out to the lungs to get oxygen. It gets pumped back to the left atrium after it's been oxygenated, and then goes to left ventricle, and then gets kicked out, excuse me, to the aorta. So here is a busy slide, right? So be careful. My pointer is on the left-hand side towards the top. Okay, so follow it along. One of the big things that I want you guys to do, I want you to start working on is blood flow through the heart. So start with your your veins, your superior vena cava and your inferior vena cava, which is down here, and then figure out how blood gets through the heart, okay? So that's what I want you to be working on this week. So I'm going to start with the superior vena cava. So superior vena cava is going to drain blood from the head and neck region and arms into this space. This space is called the right atrium, okay? Look at the bottom of the screen, bottom left, inferior vena cava is going to drain blood from the lower extremities. So thoracic, abdominal, inguinal region, and legs into the right atrium. Once blood gets into the right atrium, it's actually going to flow through this valve. This valve is called your tricuspid valve, so on the left-hand side, right? So it's also called your right atrioventricular valve because it's in between the atrium and the ventricle, the right atrium and the right ventricle. So here's the right atrium. Here's the right ventricle. I should probably use a different color for the pointer, huh? Let's see. We'll try green. Is that better? Okay. So this valve is called tricuspid because it has 3 cusps. So 1, 2, 3. If we were dissecting it, we could take a look at the cusps and how fibrous these guys are. So again, it's the right atrioventricular valve, or we call this the tricuspid valve. It is anchored to the ventricle using these chordae tendineae and these papillary muscles. These papillary muscles actually contract and make sure that this is taut. So when the ventricles contract, these valves close and blood doesn't flow up into the atria. All right, so let's take a look at the left side, right? So here's your left pulmonary veins and right pulmonary veins you can't see because they're cut off, but they drain into the left atrium. It goes through the bicuspid valve to the left ventricle and then out the aorta, right? So what I want you to do is work on right side, kicking out to the lungs and then back. Left side going back to the heart and kicking out to the body. So superior and inferior vena cava to right atrium through a tricuspid valve. Right ventricle gets pumped through this pulmonary semilunar valve. So it's named pulmonary because it's going to the pulmonary trunk. Semilunar, half-moon shaped valves, right? Pulmonary trunk, so this would be ascending pulmonary artery. This is the left pulmonary artery and right pulmonary arteries. Notice that there's a ligamentum arteriosum. Okay, this used to be a duct in the fetus so that blood would go through this and bypass the lungs because the fetus doesn't need the lungs. And so when we look at this fetal shunt, this is this would be your ductus arteriosus when you're a fetus, and then it closes and becomes a ligament, okay? So blood goes to the lungs and then comes back using the pulmonary veins. So arteries go away from the heart, veins go to. So pulmonary veins are going to the left atrium. As you're going through this, I also want you to note which side is oxygenated and which side isn't. Usually, arteries carry oxygenated blood. Usually, veins carry deoxygenated blood, except for pulmonary. So pulmonaries are the weird ones because pulmonary arteries are going to the lungs to pick up oxygen, right? And pulmonary veins are coming back from the lungs with oxygen. And so left atrium, your bicuspid valve, left ventricle, through the aortic semilunar valve. You can't see it, but it's right there. And then your aortic sinus is back there as well. And then ascending aorta, aortic arch, and descending aorta goes behind the heart, and then it goes, it's thoracic aorta, abdominal aorta, and then splits into your femoral arteries, et cetera, et cetera. A couple of things. How do we remember tricuspid and bicuspid? Try before you buy. Okay, so try before you buy. For aortic arch, here, your offshoots of your aortic arch are going to go to your body. So brachiocephalic trunk is right here. Then your left common carotid, so excuse me, this pumps blood to the right head and right arm. And then this is your left common carotid artery, and then left subclavian artery. There's also a couple of other things I want to show you. So opening of the coronary sinus is right here. So when blood goes through, excuse me, let me back up. So if you look at the aortic valve, the aortic sinus is right behind that, and that is the start of the coronary artery. So this is where the coronary artery gets its oxygenated blood, or the coronary arteries get their oxygenated blood. It's going to flow around the front of the heart, the back side, and then it's going to drain back into the heart using the coronary sinus. Okay. Another thing, look right above it, fossa ovalis. So this is an indentation, right? This used to be called the foramen ovale. Foramen ovale is what we call the fetal shunt that bypasses the ventricles. So it goes from one atrium to another atrium, right? Because you don't need the blood going to the right ventricle, and you don't need blood going to the lungs, right? Because you're getting oxygen from mom's part of the placenta, or from mom's blood. So when the baby is born, this shunt technically closes and becomes a fossa ovalis, so depression. My son still has an open shunt. So apparently it's more common than not that babies are born with the foramen ovale still open. It doesn't close to be a fossa ovalis. Usually they do close within the first month or so, and his didn't. It's likely that it'll close within the first year. And if it doesn't, they're not too concerned. They said they weren't going to do surgery because it's not that major of blood flow from deoxygenated to oxygenated area. I was born 3 months early, and this ligamentum arteriosum, or this ductus arteriosus, was open, and it never shut, so they had to go in and close it, so that my blood would go to my lungs. So really interesting. Okay, interatrial septum, interatrial, between, right? Between the atria, septum separates atria. Interventricular septum separates a ventricle. So this is the anatomy. When we get into electrocardiograms, there's a big chunk of electrical tissue that it goes through that interventricular septum. The interventricular septum is not part of the EKG, but it is part of the anatomy. So be aware of that. Atrioventricular valves connect right atrium to right ventricle, left atrium to left ventricle. The flaps form valves, right? The purpose of this is to permit blood flow in one direction from atria to ventricles. And when the ventricles start contracting, those valves close shut and don't let blood go back into the atria. These guys open and close due to pressure changes in the atrium ventricles. Okay, let's see. The right atrium, your superior vena cava receives blood from your head, neck, upper limbs, and chest. When they are trying to put in a central line, they will inject it, or a central IV line, intravenous line. They will put it into the jugular and push it down in through the superior vena cava, and then go right into the atria and then pull back up. It's really interesting, but the reason that they can do this is because of the anatomy, or the way that the heart vessels go from the neck down. The inferior vena cava receives blood from your trunk, your viscera, and lower limbs. Your coronary sinus, cardiac veins return blood to coronary sinus, right? and then the coronary sinus drains into the right atrium. The right atrium, foramen ovale, before birth, it's an opening through the interatrial septum, connects the two atria to bypass the lungs. It seals off at birth, forming a fossa ovalis. The right atrium has pectinate muscles. They're muscular ridges on anterior atrial wall and inner surface of your right auricle. So here are the pectinate muscles right there, kind of hard to see. Here are the chordae tendineae and the papillary muscles. So this is a valve. Look at how thick and strong these guys are. The purpose of these chordae tendineae are to prevent valves from opening backwards, right? And you can read the rest of that. We've talked about that. Tuberculae carnae are muscular ridges on internal surfaces of the ventricle. This includes a moderator band. It's a ridge that contains part of the conduction system. So the moderator band has portions of your internal conduction system that we can measure from the EKG. It coordinates contraction of your cardiac muscles. So here's your tuberculae carnae, and then your moderator band right there. Pulmonary circuit opens. The cornus arteriosus is the superior end of the right ventricle, leads to your pulmonary trunk, right? Divides into right and left pulmonary arteries. Blood's going to flow from right ventricle to pulmonary trunk through that pulmonary valve. Pulmonary valve has 3 semilunar cusps, hence called pulmonary semilunar valve. Here we go, right there is your pulmonary. Left atrium, blood gathers into left and right pulmonary veins from the lungs. Pulmonary veins deliver blood to the left atrium. Keep in mind they're veins. These are the only veins that are carry oxygenated blood, and the pulmonary arteries are the only arteries that carry the oxygenated blood in the body. Okay, left ventricle holds same volume as right ventricle. It's larger, the muscle is thicker and more powerful. Why do you think? Has to pump blood to the body, okay? So internally, it's similar to the right ventricle, but it doesn't have a moderator band. The systemic circulation, so blood leaves left ventricle through aortic valve into ascending aorta. It turns into aortic arch and descending aorta. So here's a picture of it. So here is your left ventricle, and here is your aortic valve and aorta, ascending aorta. Right ventricle wall is thinner. It develops less pressure than left ventricle. You don't have to pump that far, you just pump to the lungs. Left ventricle has to pump out to the rest of the body. So if you take a look, right ventricle is pouch shaped, left ventricle is sort of round, right? Left ventricle has more massive muscle than your right ventricle because you're going to have to generate enough force to pump out to the body. Here's relaxed and here's contracted. Atrioventricular valves are between atrium and ventricles, right? Here's your AV valves. And then here are your semilunar valves going out to the blood vessels. Let's see. Aortic sinuses. So aortic sinuses are at the base of the ascending aorta. They're sacs that prevent the valve cups from sticking to the aorta. This is the origin of your right and left coronary arteries. So if you could see, the sinuses are right here. There's one right there and one right there. And the aorta is actually behind the pulmonary. And so it's right after those valves. So it goes aortic valves, aortic sinus, and then ascending aorta. The cardiac fibrous skeleton supports cardiac muscle fibers, distributes force of contraction, adds strength to prevent overexpansion of the hearts, and elastic fibers returns heart to original shape after contraction. We have 4 bands around heart valves and bases of pulmonary trunk. stabilizes valves, electrically, insulates the ventricular cells from atrial cells. So this is important when you look at electrical flow from the heart. We have a cardiac or fibrous skeleton. One of the functions of that is to make sure that the atria, when it gets excited, it doesn't go jumping right to the ventricle. It has a conduction system that it has to follow. Blood supply to the heart is the coronary circulation, the coronary arteries, and cardiac veins. Supplies blood to the muscle tissue of the heart. Coronary arteries, left and right, originated aortic sinuses, high blood pressure, and the blood going into the aorta is going to push that blood into the coronary arteries. So here's a really good picture. So the arteries originate behind the aortic semilunar valve, or just distal, right, to that valve. And so here is your right coronary artery. Here's your left coronary artery. Notice that it becomes the circumflex artery, right, around. And we also have the interventricular, so interatrial interventricular artery, right? And then, and it has all these little tributaries. Then the blood drains back into the right atrium. Right coronary artery supplies blood to right atrium, portions of both ventricles, the SA node and AV nodes. And your left coronary artery supplies blood to left atrium, left ventricle, and interventricular septum. If that left coronary artery gets blocked and it blocks off parts of that interventricular septum or left ventricle, you're going to have a really tough time. When those heart cells die, the interventricular septum has a lot of the conduction system to pump the heart. And if that gets damaged, then your heart isn't going to be effective pump. Two main branches of left coronary artery, circumflex artery and anterior interventricular artery. Anastomosis, interconnect anterior and posterior interventricular arteries, stabilize blood supply to cardiac muscles. Okay, the cardiac veins, there's a great cardiac vein, right? Anterior cardiac vein and posterior cardiac vein, and middle and small. Here are your cardiac veins, right? And they're going to drain into your right atrium. So the coronary circulation goes aortic sinus throughout the heart to the tributaries to coronary sinus back into the right atrium. So this is oxygenated blood, delivers it to the heart tissue, the myocardium, the contractile cells, to the coronary sinus, and this is deoxygenated. Okay. Here's a highlight, so I like how you can actually see the heart picture, right? Here's an actual heart. So it's a human heart, and it was dyed for the arteries. And here's a normal heart, right? Here is one that has part of your coronary circulation blocked by a blood clot. And so notice how this whole region it's actually the left side of this person's heart, so left ventricle, is not getting blood. And so these heart cells are dying. And so it's not going to be a functional heart because the blood flow is cut off. Fetal and maternal circulation. So embryonic lungs and digestive tract are non-functional. Mom's placenta provides respiratory and nutrition functions, right? So fetal circulation bypasses the lungs and the liver. So blood from the placenta goes to the fetus. Note that mom has a placenta, so that's one of the organs that is only found in women when they're pregnant. So mom has a placenta and the baby has a placenta, and those placentas don't enmesh, they interface with one another so that oxygen and nutrients go from mom's side of the placenta into the baby side of the placenta. Then it goes from umbilical veins to the ductus venosus, bypasses the liver, you don't need the liver for digestive functioning, to the inferior vena cava. Your foramen ovale and ductus arteriosus, what I was talking about earlier for the heart, bypasses the lungs. Blood then flows to the placenta from the baby, less oxygen, less nutrients. It goes from internal iliac arteries to umbilical arteries and umbilical cord to placenta. So here is the baby's part of the placenta, your umbilical cord, right? Here is your umbilical vein, because remember, it's going to the heart, so it's going to bypass the liver. So here's your ductus venosus going to the inferior vena cava. And then we don't need to go to lungs, so the blood is going to flow through the foramen ovale, bypass the ventricles. And then you also have another shunt called the ductus arteriosus, which is going to connect the pulmonary to the aorta, because you don't need the lungs, right? And then notice that you have blood coming back from circulation. Well, okay, so this would be the baby's aorta, right? And this would be the baby's inferior vena cava, ultimately. And then here's the blood supply. So this is the umbilical arteries going back and taking deoxygenated blood to the placenta. Pretty cool, huh? So fetal circulation, just to zoom in, this foramen ovale is actually closed, but it is normally open in a fetus, so it's called a foramen ovale. And then after it closes and heals closed, it's called a fossa ovalis. The ductus arteriosus is open in fetuses, and in this picture it's closed, but once the fetus is born, it closes and becomes a ligamentum arteriosum. This was still open in me, and in my x-rays you can actually see wire mesh sewing shut. In my son, the foramen ovale is actually still open, and hopefully it'll close. Ductus venosus closes within minutes of birth. It turns into ligament venosum, so that is to your liver. When the newborns breathe air, lungs expand, rising O2 levels cause the ductus arteriosus to constrict. This is the pressure, due to the pressure in the lungs. So once it heals and it stays as connective tissue, it's going to be a ligament. Rising left atrium pressure causes a foramen ovale, and it turns into a fossa ovalis. Here are some congenital defects, and so this is something that I'm not going to ask you, but you will have to know for your programs. So patent foramen ovale and patent ductus arteriosus means that these stay open. So patent ductus arteriosus is what I had. That means that this stayed open. They went in and closed it. The patent foramen ovale means that foramen ovale stays open. Ventricular septal defect. So sometimes there are holes in the ventricular septum so that blood mixes, so the oxygenated and deoxygenated blood mixes. One of my students actually had 12, he had a birth defect, he had 12 holes in there. So they went in, they took tissue from the outside portion of the apex of the ventricle and sewed it in to heal this area. Tetralogy of Fallot means that you have a ventricle septal defect, your patent ductus arteriosus is still open, and you have a pulmonary stenosis. So this is narrowing of the pulmonary artery, so that blood either can't get through or blood has a really hard time getting through. Transposition of the great vessels. This would be when the aorta comes off of the right ventricle and it's not supposed to, and then the pulmonary arteries come off of the left ventricle and they're not supposed to. And most of these can be corrected with heart surgery. So here's atrioventricular septal defects, where there's hole in the atria and holes in the ventricles. Okay, let's move on. So blood vessels. If you think of blood flow goes from the heart to arteries, then to smaller and more numerous arterioles, to capillaries, to venules, veins, and back to the heart. Arteries and arterioles carry oxygenated blood to capillaries. Capillaries end in organs or tissues, like extremities, where oxygen can diffuse into the tissues and CO2 can diffuse back into the blood. Then the venules carry blood back to the veins, and then the veins carry blood back to the heart. Or this works, we could put lungs here as well. So lungs, except for it goes, well, I guess not quite. So arteries are large. They're the main vessels that conduct blood away from the heart. Arteries always go away from the heart. Arterioles are smaller vessels in peripheral tissue. They're more numerous, but they decrease in diameter. So you have an increase in resistance. You can tell the difference between arteries and arterioles because arterioles are more, they have more elastic fiber and more smooth muscle because they're going to constrict and dilate and regulate blood pressure more effectively. Capillaries, capillaries have one layer, so they have the innermost layer of blood vessels, just the simple squamous endothelium, because this is where diffusion has to take place, and you can't have 3 layers of blood vessel lining if you expect diffusion to take place. Venules collect blood from the capillaries, veins return blood to the heart. So here's the 3 layers. So this is the outermost layer, which is the tunica externa. That's connective tissue for the artery and the vein. Then the tunica media, which is smooth muscle. So the tunica media is smooth muscle and elastic fibers that is going to constrict and dilate, or it's going to constrict to decrease the diameter of the blood vessel and relax to dilate the diameter of the blood vessel. So this is going to regulate blood pressure greatly. And then the tunica intima is a little bit of connective tissue with an endothelial lining. Look at the cross-section picture. So the artery holds its shape really well. This artery has a lot of elastic fibers and smooth muscle. Look at the vein. The vein is much more distendable and it does not hold its shape very well. Pulmonary circuit. Pulmonary arteries go from the heart to the lungs. They carry deoxygenated blood. Draw this out, you guys. Make sure you understand circulation to the lungs. The pulmonary trunk comes off the heart, right? So you have the pulmonary trunk. Then it turns into left and right pulmonary arteries. And then they branch into pulmonary arterioles. And then they break into capillary networks that surround the alveoli. They then go back to form venules and then veins, and then they empty into the left atrium. Contains 84% of blood volume, supplies the entire body except for pulmonary circuit, which would be the systemic circuit. Systemic arteries, blood moves from left ventricle into ascending aorta, aortic arch, and descending aorta. The coronary arteries branch off from the aortic sinus. So here's the ascending aorta, aortic arch, descending aorta. This becomes the thoracic aorta, then the abdominal aorta, and then it branches into the common iliac, the internal and external iliac, and then the external iliac breaks up into the femoral arteries. All right, take a look up atop. So here is your brachiocephalic trunk that ends up becoming your common carotid, which branches off, into your, sorry, you guys, I got lost. Brachiocephalic goes into common carotid, and your external and internal carotids. Then it goes into vertebral artery, which runs really deep, smacked against the vertebrae. So you have carotid going up to the brain. The carotid actually, the external carotid provides blood vessels to the skin and face. Internal goes into the brain. The vertebral goes into the brain too as well. And then we have the right subclavian, and then subclavian means below the clavicle, and then it becomes right axillary, right brachial, right radial, and ulnar, and then your pulmonary arches. Here's a better picture, so look this over. I want you to know the main stuff. So obviously know the aorta, know that it branches off into the iliac, right? And then the branches off of the aortic arch as well. And then common terms. So axillary is under the armpit. Humeral circumflex would obviously be near the humerus. Circumflex means it goes around the bone. Brachial, right? Take when you are listening for pulse or blood pressure, you're going to put it in this cubital region right there and listen to the brachial artery. The radial artery, ulnar artery, and then the pulmonary. Here's your thoracic aorta, abdominal aorta, and it branches off to all these different tributaries to the organs, and then it turns into your internal and external iliacs. Femoral artery, you have a deep femoral artery, becomes a popliteal. So we have different names for that artery. We have different names of the same artery, just different locations, so it has different names. Excuse me. Your deep femoral artery comes popliteal artery, that is behind the knee, right? You can feel pulse there. Branches to form the posterior and anterior tibial arteries. Posterior gives rise to fibular arteries. There's your pictures, so follow that through. Right, here's a front side, anterior side, here's a posterior side. So there's a popliteal. You can take pulse rate on popliteal. You can also feel for pulse rate in the dorsal pedis. And so when I was pregnant and I had really high blood pressure, they would feel my pulse of my legs and feet to make sure that I was getting enough blood flow there and there weren't blood clots. They would also look at the reflexes of my feet to look at my central nervous system. There's a close-up view. Veins, kind of nice because they usually have the same name and they're just called veins. So they run side by side for arteries and veins. Veins are usually more superficial, whereas arteries are more deep and meshed near the bone for protection. In neck and limbs, we have one set of arteries that are deep and then two sets of veins, one deep, one superficial. Take a look at your veins. So notice how you see ulnar, radial, brachial, right? Cephalic, axillary, subclavian, brachiocephalic, jugulars, vertebral. They're going to drain into your superior vena cava and then go into your heart. We have your deep femoral, right? Your internal, external iliac, your lumbar veins, right? Then we have the inferior vena cava, and most of your veins drain into that inferior vena cava. Here's the veins of your legs, so saphenous, popliteal, small saphenous, fibular, plantar venous arch, and then dorsal venous arch. Hepatic portal system. It's a system of veins that directs blood flow from digestive organs to liver sinusoids for processing. So this is super cool because your blood goes from your GI tract with all these nutrients into your little processing plant, your liver, and then dumped into the inferior vena cava. This has a lot of nutrients, you guys, and so the blood goes to the liver for processing. You can imagine that the particle concentration of this blood is really high. Has a lot of nutrients, and it's going to go to the liver spaces to get processed, right? Here's your hepatic portal system, so take a look. It pulls from the mesenteric or omentum, right, from your digestive tract into your hepatic portal to your liver. Liver processes it, and then it gets dumped into hepatic veins and into the inferior vena cava. So this is like a super portal system for digested food. Blood flow to the brain is top priority. Brain has high oxygen demands. When your blood pressure drops and if you're losing blood and your blood pressure drops, we'll talk about mean arterial blood pressure in a later talk. Your peripheral vessels constrict, but your cerebral vessels dilate so that you can get blood flow to that brain. Common carotid arteries divides into external and internal, right? So external supplies blood to the structures of the neck, lower jaw, and face. Internal enters skull, delivers blood to brain. It branches off into three regions: ophthalmic, anterior, and middle cerebral artery. Ophthalmic obviously is going to go to the eyes. And there's your picture, so follow your pictures through. The vertebral artery, left and right, also supply brain with blood, but they go sort of in the middle backside. So they enter the cranium through the foramen magnum, right? They rise from subclavian arteries. They fuse to form the basilar artery. And these guys form the posterior cerebral arteries. And they become the posterior communicating arteries. So you have this circle. It's called the circle of Willis from these arteries. So you have those vertebral arteries coming up that form this posterior cerebral communicating artery, right, region, and supplies this part of the brain with blood. Then you have your carotids, which supply these regions, the frontal portions of, middle cerebral and frontal cerebral, with blood. I don't expect you to know all these details, but this is actually called the circle of Willis, and it's made up of posterior, middle, and anterior communicating arteries, or anterior cerebral. And it comes from your vertebral arteries and from your carotids. Okay, guys, work on drawing out your major blood vessels of your body and fetal circulation, liver, and brain. Study well.